Hi, in this video we will discuss about how to read a chest x-ray. So, first of all, we need to know that what are the different techniques by which we can get a chest x-ray. So, first one is a PA view, posterior anterior view. In this you can see the distance between the radiographic machine and the patient is approx 180 centimeter. Second one is the AP view, anterior posterior view. In this the distance is 90 centimeter. Third one is the lateral view, and fourth one is the lateral decubitus view. So these are the four basic views by which we can get a chest x-ray. Now let us see the difference between the PA and the AP view. So you can see the position of the heart in the two PA and AP view. Also you can see the difference between posterior anterior and anterior posterior view by watching the x-ray. So in the AP view you will see that this ratio, cardiac to thoracic ratio, CT ratio, we will talk it about later. So CT ratio will be greater in case of AP view. So in case of AP view it will be approx 0.6 or 60%, while in case of PA view it will be approx 0.5 or less. So what are the difference between the two views? You can see that scapula is seen in periphery of the thorax. You can see over here while it is not seen in the AP view. Clavicles project over the lung fields while clavicles are above the apex of lung fields, while posterior ribs are distinct and anterior ribs are distinct in case of AP view. Now there are the different radiographic opacities by which you can understand that how they are going to appear in the radiographic film. So air will be the darkest one, it will be a dark black colored. Fatty tissue will be like a little bit, means little bit whitish. Soft tissue will be approx mid range, like white and black mixture. Bone will be like this, and metal will be the brightest. So this is the least opaque to the most opaque, most lucent to the least lucent, or we can say black to the white. Now before reading any radiographic film we need to check some of the points, and these are the must check points. If you don't check, then you are not going to present or interpret a radiographic film correctly. So what are those? First of all, you need to check out the patient details of the x-ray film, where it is written the name of the patient, name, age and all, and the date of examination at all, neck all these things. Next one is the view, the which view the x-ray is taken, whether it is PA view or it is AP view or any lateral decubitus or all. Third one is the breath, whether it is an inspiration or expiration x-ray. Generally we take inspiration one, we will talk about this also later. Then we will check about the rotation, whether the x-ray is normal or the patient has rotated during the taking of the x-ray. Next one is penetration or exposure, whether it is adequate exposure or not, or it is overexposed or little exposed or not, and when and why it was taken. We need to consider these points before interpreting any x-ray film. Now let's see the inspiratory and the expiratory film. So if 6 complete anterior or 10 posterior ribs are visible, then the patient has taken an adequate inspiratory effort. So 6 anterior or 10 posterior ribs, you can see over here 1 2 3 4 5 6. So you can see 6 anterior ribs are seen, so the patient has taken adequate inspiratory effort. If there are less than 6 anterior ribs, this implies a poor in inspiratory effort, and more than 6 ribs implies hyper expanded lungs. Next one is the rotation. So if the distance between the medial borders of the clavicles, so these are the medial borders of the clavicles, you can see over here, so and the midline is same on both the sides, then it is known as well centered radiograph. So how will you interpret them? You will check over here, this is the center line, midline, and these are the medial borders of the clavicle. So you can see over here that the distance between them is approx equal, so it is a well centered. Now we will look for the exposure, whether the x-ray has been correct or adequate exposed, or over penetrated or hyper exposed or hypo exposed. So first of all, let's go for the definitions. That adequate exposure means the intervertebral discs through the heart or the lower thoracic vertebrae are barely visible. So adequate exposure means barely visible. So here you can see optimal or adequate exposure. In this we can see these the intervertebral discs are barely visible. We can't see them properly, but at least we can get an idea that yeah, there are intervertebral discs we can see. Then comes the hyper exposed or the over penetrated. If the intervertebral discs are clearly seen, so overexposed or hyper exposed, this is the C X-ray. Here you can clearly cut out these are the intervertebral discs, you can clearly see them. So this is the hyper exposed. You can also see the exposure by this blackish shadow, because as this shadow is generally seen in case of pneumothorax. We will cover it in the next part of the video, so you can get an idea of the pneumothorax also. But here the intervertebral discs are clearly seen, you can clearly see them. So this is an overexposed or hyper exposed X-ray. Next one is the under penetrated or hypo exposed. If the intervertebral discs are not seen in the film, so this is the underexposed A. Here you can't tell that where the intervertebral disc. Now we will understand how to interpret any normal chest X-ray. So first of all, we will look for the trachea. It is slightly tilted towards the right due to the presence of aortic arch. Here you can see this is the aortic arch, and this trachea is tilted slightly towards the right. So how will you get about this, that it is tilted? You can see that this gap is more compared to this. This is the right side and this is the left side. So you can make it out that this is slightly tilted towards the right. Next one is the heart size. It is measured by the cardiothoracic ratio. We also talked about this earlier in the PA and AP view differentiation, that in case of AP view it is approx 0.6, while in case of PA view it is approx 0.5. So you can make it out by CT ratio, cardiothoracic ratio, equals to CL plus CR divided by T, where CL plus CR means transverse cardiac diameter. You can see over here, this is the CR, this is the CL. These are the two transverse cardiac diameter, and T means the transverse thoracic diameter. This is the T. You can see this is the normal values of CT ratio. For PA view it is less than 0.5, for AP view it is less than 0.6. Next one is the hilum. This is the depressed surface. So depressed surface, any depression, so this is on the medial side, so the convex side is on the lateral and concave on the medial side. So these are the lungs. So here you can see hilum, so the convex part is on the lateral side while concave part is on the medial side. A depressed surface is the center of the medial surface of the lung, and it lies anteriorly to 5th through 7th thoracic vertebrae. So what is the hilum? It is the entry point of bronchus into the lungs, and its medial side. Left hilum is higher than the right one. So the left hilum is at the higher position compared to the right. If the right hilum is higher than the left, then something is either pulling or pushing the right hilum. Now next one is the mediastinum. Next we will look over for the diaphragm. The left dome is lower compared to the right dome due to the weight of the heart. Next is the costophrenic and the cardiophrenic angles. So this one is the cardiophrenic angle, the angle between the heart and the diaphragm. And the green one, this is the costophrenic angle. This is the angle between the chest wall and the diaphragm. So in order to interpret any chest X-ray, you just need to see these simple things. First of all, you will check whether the trachea is tilted or not, whether it is straight or not, tilted or not. Then we will look for any bone deformity. We will also look for the bone deformity, whether the bones are broken or not, or they are okay. Then we'll look for the hilum, whether the right hilum is at the higher position than the left or not. Then we will also look for the CT cardiothoracic ratio, as in case of cardiomegaly this ratio is increased. We will look for them in the next part of the video. Then we will look for the angles, whether the angles are observed or not. If the angles are not seen, these are not seen in case of pleural effusion, because the fluid accumulates, and in case of x-ray we will not able to see any of the angles. So thanks for watching the video. Do subscribe. If you want the notes, you will find a link in the description to download. It will cost you a bit, but these will be worth it. Hope you like the video. Do share and subscribe for more. Thank you.